When I was about 12 years old, my father had a heart problem that continued to degenerate over a period of about 5 years. He had been under the care of his primary care physician and his cardiologist for about 5 years at that time. At this point, he was experiencing pain that went from his neck down into his arm and hand, just getting out of the car and walking into an office 15 or 20 steps. He went in for an examination, and the doctors were sorry to tell you, Mr. Gossett, you have approximately 1 month to live. We've done all we can do. Well, someone in town recommended a chiropractic physician in town who had taken postgraduate study in cardiology as it relates to chiropractic. So he thought, well, I don't have anything to lose, so he went in for a visit. In the history, the doctor revealed that he'd had an accident as a child that had injured his cervical spine and upper thoracic area, which sends part of the primary nerve supply into the heart. He said, there's a good possibility I can help you. I certainly can't hurt you from what the other doctors have told you. So he recommended some chiropractic adjustments, nutrition for the cardiovascular system, heart and blood vessels, and then an exercise program based on Dr. Cooper's work, which we all know now as aerobic activity. He was 35 at that time. He lived to be 77 years old. So I was so inspired by that situation that I decided I would like to become a physician and help patients with their health problems as well, and in particular study how to help these types of patients without drugs and without surgery. So that's why I'm a chiropractic physician today. The way in which I am different from other doctors who treat peripheral neuropathy is, first of all, my postgraduate education. In studying the new research, I'm able to take advantage of the new discoveries that have been made and the cutting-edge technology that's available both in diagnosis and treatment, which is leaps and bounds ahead of the traditional forms of care. The traditional doctors are using protocols that are 10 to 15 years old and based on research that's at least that old, if not older. The protocols and the technology that I use are up to maybe just 3 months old. So there's a big difference in the education that I have versus what the traditional doctors that you've been to have. Also, the experience in treating these kinds of conditions with new and different protocols I have, which no one else does in this area. And last of all, the success rate that we have is much higher than the success rate of the other doctors in the area treating peripheral neuropathy. The reason that our success rate is so high is because we're getting at the cause, the root cause of these different types of conditions, of which peripheral neuropathy is one. We are looking at any structural nerve root irritation that would contribute to the peripheral neuropathy at the spinal level. Then we are looking at any brain, spinal cord, or peripheral nerve imbalance that's contributing to the peripheral neuropathy. And we're also looking at the internal body chemistry to see if there is anything throwing gasoline on the fire or irritating the cells that are being irritated or under imbalance neurologically. As a result, we're looking at fighting a battle that's on 3 fronts, and we're sending a general to each front rather than simply treating chemically or structurally or neurologically individually. It's important to take and attack all 3 fronts in order to make a change in this type of program, or in this type. It's important to take an attack on all 3 of these fronts in order to change the overall condition. Otherwise, you're going to continue with the lack of success that you've had in the past. So what I do is send a general to each of those fronts, attacking the orthopedic problem, the neurologic problem, and the metabolic problem. In that way, we are addressing each of the issues, the core issues that are contributing to your peripheral neuropathy. This is the only way we can truly make a change in your condition, especially for the long term. as I stated before, most of the doctors, the average doctor across the nation, uses protocols and diagnostic approaches that are at least 10 to 15 years old. The protocols and the diagnostics that we use may be only 3 months old. We're using the most recent cutting edge research to your advantage to get to the core of your problems and get you as well as quickly as possible. The approach that we take, again, is based on new cutting-edge research and technology. This is research and technology that most of the MDs are unaware of, much less the insurance companies. So neither the MDs nor the insurance companies have caught up with this new information, and that's why usually it's not covered. Insurance companies are about the bottom line. When new procedures, technologies come out, they are slow to cover it because that helps their bottom line. And if we look at what they have covered in your past has not been helpful. So at this point, you need to look at what insurance has done for you. What has it done for you? How has it helped your condition? What they've covered, has it actually helped you? Probably not, or you wouldn't be watching this video. So if traditional health care and insurance has not helped your situation, if you continue to suffer from degenerative diseases like peripheral neuropathy, then you're going to have to think out of the box. You're going to have to take some responsibility and try alternatives that have already been proven to be effective, and also be willing to accept the responsibility financially to cover that care. We have many patients that drive anywhere from an hour to 2 hours one way to come here for treatment. The reason for this is they can't get this type of care where they live. So I would encourage you to consider this is another responsibility that you need to take. Be willing to step out and make the drive to get somewhere here where you can get your questions answered and get your condition improved and get your life back and your activity levels back up. So at this point, you have to think to yourself and you have to decide, is it worth it to me to drive an hour and a half, or 2 hours to get my life back? You qualify as a potential patient at this clinic if you've had this condition for more than 6 months, if you've been to your primary care physician and 1 or 2 specialists, and perhaps even another chiropractic physician. You also qualify for this condition if your pain on a scale of 0 to 10 is 7 or higher. You also qualify if you're willing to accept responsibility for your care, if you're willing to make lifestyle changes, and if you're willing to make a financial commitment in payment for part of the care that's rendered. The individuals who make the best patients are those who, like I said before, have a pain rating of more than 7, have been to several doctors without improvement, and are sick and tired of being sick and tired. They're willing to make the drive, they're willing to pay for their care, and they're willing to spend the time that's necessary and the effort to get the therapy they need to improve their condition and get their life back. The last thing is important is they need to be willing to make lifestyle changes, whether it's changes in their diet, exercise, and those types of things. They'll be recommended as needed by myself. Our success rate is a minimum of 75%. These are patients who their symptoms have improved, been reduced, or eliminated. And this is not just for the short term, but for the long term. This is in comparison to the traditional care, which simply seeks to manage the symptoms, the condition continues to worsen, and spin off other conditions as well as the primary symptoms or chief complaint that you're talking with me about. No physician can guarantee their work. Why is that? I can't guarantee my work because you're only here a few hours a week. The rest of the time you're on your own. I depend on your accountability and responsibility and follow through. And you'll have to count on yourself. You can count on me to do the work I need to do. You need to count on yourself to do your part. If we're both pulling together, your condition has no opportunity but to improve.